Okay, go ahead, Diane.
Okay, so if you don't mind clicking on that International Student Insurance Plan link, that will take us to the website that my company has set up specifically for the international students at College of San Mateo. And there's a wealth of information here for you. The contact information, should you have a question for enrollment or eligibility or questions about benefits. There's 2 different numbers here, and there's 2 different websites. If you feel more comfortable asking a question, writing it out versus calling, we do have a language service that is connected to these phone lines. So if you decide you'd like to call, you can request the language service. There's no cost, and speak in your first language. So that is available for you. Enrollment, the district enrolls you, as Aubrey already mentioned, so you don't need to worry about enrolling yourself. If you happen to have a dependent would be a child or a spouse partner. You can enroll them in this plan, and then you would need to reach out to Aubrey for that enrollment information. But if it's just you, no worries, you will be already enrolled in the plan. If you'd like to scroll a little bit, Aubrey, I would just like to show the students the different links here for them. The snapshot is a quick plan overview. It gives you the dates of the semesters. It gives you the cost. It gives you a brief overview of the benefits. We don't have to open it up if you don't want to, Aubrey. The students can find that themselves. Insurance ID card. This is an important site here. Maybe click on this one. Once the district sends in your name and information to my office and everything processes, you will get an email telling you, it's one of those do not reply emails that will say you're ready to download your ID card or something to that extent, and it will give you directions for that. And if you are a new student here, then you need to come up to create an account at the top page, Audrey. Okay, and then just fill in this information. First name, last name, date of birth, your school email address, and your school student ID number. And then that will match, and it really shouldn't take 72 hours to get your card. It should be ready within minutes or at least a few hours. So then you would submit, and you're on your way to getting your ID card. So if we go back to the main page, Aubrey.
Mm-hmm.
And I apologize, everyone, there's no visual for me because my computer, for some reason, if you have a visual, there's no audio. So I'm just this voice off in the woods here. But anyway, how to use your plan, we're going to come back to that document. And finding a provider, we're going to come back to that link as well. A provider is another name for a doctor or a hospital or an urgent care. But we're going to come back to this link, so you don't need to click there. But if we scroll down a little bit further, we get to information on the Student Health Center, which of course, because of COVID, no one is on campus, and so no one is walking into the Student Health Center. But once we're back going to classes on campus, you could click here and find out the campus hours, where it's located. Oh, here we go. It gives you all this information here. But right now, and a link right to their site. Right now, it's just telemedicine, but there's information here on how to set up an appointment through telemedicine. Okay, and then plan materials, the various plan materials, if you click there, we can see what's there for you. Some of them are up top as buttons, but they're also located down here. WellConnect. WellConnect is an extra tele-MD service that the school has purchased for you. If you click on there, Aubrey. and scroll a little bit down, there's links. And if you go over, not on that one, oh, okay. This one connects you to the site. I was going to say, click on the PDFs to the right under downloads. This gives you an overview of the services that WellConnect offers. And it's offered to anyone living in your house. So they may not, your roommates may not be international students, or they may not be attending College of San Mateo. It doesn't matter. Anyone in your household has access to this information here. So the services are wide ranging. It's not just medical or mental health. It could be help with finances or help with finding a daycare, let's say, if you had a baby. And of course, that's a little different right now too because of COVID, but under normal circumstances, they could help you find childcare, for instance. It's 24/7, and there's information on where you can call them, how you can email them, a lot of information here. So Aubrey, if we go back to the other document that was PDF'd, it gives you some of the same information, it just breaks it out differently for you. Okay. So we can go back to the page, yeah. And then there's orientation video. We don't need to play it right now, but that's something the students could come back to, the WellConnect website. You already clicked, but this is some really great information for you to help expand getting help for various things.
Diane, maybe we can talk a little bit about the code to use if students want to log in.
Yeah, the code is SMCCD, and it's in that the first two PDFs we looked at gave that information, but you sign in by using the district code there. Okay, and then also at the bottom of the page, if you scroll right down to the very bottom of the page, there's other information here, but what I want to look at is the supplemental plans. So this health insurance plan is accident and sickness only. And what that means is, besides other things, is there's no dental and vision. So no getting your teeth checked. If you happen to have wisdom teeth issues, they aren't covered. Eyeglasses, contact lenses are not covered on the plan, but there's voluntary plans here that if you wish, you could purchase that will cover these things for you. But you don't have to, it's totally voluntary. Okay. So let's go back up to the how to use your plan. And Aubrey, did you give the students one of those memory sticks that has all the plan material on it?
Not this year because we haven't seen them yet, but everything is on our website. Okay,
okay. So in a normal year, you would have received a memory stick that has this document along with some other documents. But like Aubrey said, you can easily access this on my website that we're looking at, or it was also back on the school site. Mm-hmm. Yeah, right here.
So we want to go back to the
yes,
insurance
let's go
booklet?
Through the house. Yes. Mm-hmm. So there's a wealth of information in here, and as Aubrey said, you're not going to remember everything, but you can always come back to this if you need help remembering, if you need to seek help with your health. So we've already talked about enrollment, and there's, again, our phone number if you would like to call if you have questions about enrollment. please call that number. It's our customer service number. And we did talk about the insurance ID card, how you will receive an email notifying you that your card is ready, and the member portal that you need to go to. Please, once you go into that and look at your ID card, if you're able to, you can download it and print it, or take a picture of it on your phone. I know students carry that, we all carry our phones everywhere we go, and it's important to have your ID card with you at all times. You never know when you're going to need it. You could be out for a walk, trip off a curb, suddenly you've sprained your ankle, maybe you need to go get help at an urgent care. If you don't have your ID card with you, the visit will be billed to you and not the insurance company. So it's really important to have that information with you at all times. We also have a mobile app that you can look into creating. Gives you the directions here on how to do that. So what do you pay for your insurance? So healthcare in the United States is extremely expensive. Some of you maybe have already had reason to use the healthcare system here, and you probably know what I'm talking about. I'm from Canada originally. We have universal medicine, so it was a shock to me what things cost. So people purchase insurance to help negate the cost of the healthcare. So you pay for the insurance charge to have the insurance. That is what's billed to your student account. There's something called a deductible. A deductible means, in this case, a $100 deductible. The very first time you use your insurance, you pay the first $100. So if you go to an urgent care and are seen by a doctor in the urgent care, I don't know what the bill would be. I'll just guess and say it's $300 to be seen in urgent care. You will pay the first 100. Insurance picks up the second 200. So let's say a month later something happens and you need to go back to urgent care because you have a sore throat. You don't pay the deductible again because you've paid it. It's a one-time $100 payment per policy year. So insurance in that case will pick up the full amount. I know this is kind of hard to understand, but just know the first $100 you'll get a bill for from the wherever you are, the hospital, the urgent care, the doctor's office. But after that, insurance picks up the cost if you're in network for Aetna, and I'll talk about that in a second here. There is a $250 co-payment every time you visit an emergency room. So if you can, stay out of the hospital emergency rooms. Hospital emergency rooms are for true emergencies. You've been in a car accident, you can't stop bleeding, you can't breathe, very urgent matters. If you go to the emergency room and, I mean, they'll see you, you may wait a while to be seen, and in the days of COVID here, please call ahead because they don't want you necessarily in the emergency room if they have COVID patients there. So things are a little bit different, but let's say there's no COVID and you take yourself to an emergency room. If you are not admitted to the hospital, if they don't say, okay, this is serious, you need to be checked into the hospital, you will have a $250 copayment. If you're admitted to the hospital, that's waived, you don't pay that. So only go for serious things. Some things are not covered under the plan, just going for a physical. I know in a lot of countries, you just go to have a physical every year. You feel fine, there's nothing broken, you're feeling great. That is not covered on this plan. So if you go to a doctor for a physical, you will end up with a bill for that physical. It's called an exclusion. Another exclusion is coverage for acne. There's a few little exclusions on this plan, but basically any accident and any sickness, you'll be covered on the plan. Okay, we can move on. So where to access care? Well, if you are on campus and if the campus was holding classes, a great place to start is the Campus Health Center. But because of COVID, if classes are in session, you could call the Campus Health Center for a tele-MD appointment. And Aubrey had mentioned that there's another orientation where the Campus Health Center will speak to you. So you'll get more information on that. I think it's next week, Aubrey, or in a couple of weeks.
Actually,
I forget when.
August 24th. It's a Monday, the Monday
Okay.
after school starts.
Okay, so August 24th, you'll hear more about the tele-MD from the Campus Health Center. And you can also go back to the link to the Campus Health Center because there was information on the tele-MD there. It's a great place to start if classes are in session because there's no cost. There's no deductible. There's no cost to you to use the Campus Health Center. If the Campus Health Center is not an option for you, let's say it's a weekend or let's say it's this coming Friday, you don't feel well. The urgent care would be your next best bet to seek help at an urgent care. But again, because of COVID, please call ahead to the urgent care center that you're choosing to go to. Without COVID, you would normally just walk in and they would see you. Physicians' offices are another place to seek assistance. I would use a physician's office more for an ongoing issue. So let's say you're diabetic, or let's say you broke your leg. Any place you would need follow-up appointments, I would go to a physician's office because if you call the physician's office, you don't always get in right away. With an urgent care, you would get in right away. With campus, you would get in right away. Physician's visits could take a week to get an appointment. So I would use the urgent care before a physician office visit unless you need ongoing care. And then I would choose the physician because you want to see the same doctor every time you go back for your follow-up. Hospitals are for scheduled surgery, and as we mentioned earlier, medical emergencies only. Okay, we can move on. Now, I'm going to show you how to find an urgent care or how to find a physician. Your network of doctors, thank you. Your network of doctors is the Aetna Passport to Healthcare primary PPO. You will be covered at 100% if you stay in network, and it's for accident and sickness. If you go outside, there can be other charges. So you will save money if you stay within the Aetna network. The Aetna network is a very strong doctor hospital network. You will not have trouble finding doctors in this network. And I'm going to show you how to find facilities and doctors. And Aubrey, if you just scroll down, there's a link within this in the next paragraph. Right here, and it gives you directions on the steps to take, the directions for what I'm going to show you right now. So I would suggest, highly suggest, coming back to this site in the next week or so because you want to know how to use this site before you're sick. If you're sick and you go, oh no, what did Diane tell me to do? I can't remember. You can always come back to this page. But if you've gone to the site and just played around with it, I think you'll be confident that you can find an urgent care or a doctor or a hospital right away. So let's go to the site. And just so you know, when you're using this site, the distance, look within, you have to change the miles before you put in your location. And I like to go 5 to 10 miles, depending on where you're located. Aubrey's going to use 9, and because I don't know where you all live, I'm just going to use the school zip code But if you lived in San Francisco or you lived in San Jose or you lived wherever, you would put that zip code in that you're closest to. If you're traveling, if you went to visit a friend on winter break, let's say you went to New York City, you could use the same site in New York City. You would just have to put the zip code for either the hotel you're at or the friend's home you're at, and you'll find doctors if you need to find a doctor.
Should I hit search now?
Yes, hit search. And then it says select a plan. You don't need to put anything in the first box, but you do need to click Passport to Healthcare Primary, the first button here. And then continue. And once again, scroll down a little bit. I don't put anything in that first box. I go down to the box because you don't know your doctor usually. You're trying to find a doctor. So we can look up urgent care, we can look up labs, we can look up all of these different facilities. Aubrey, so would you like to go to an urgent care?
Yes.
Okay.
It's a lot. It looks like a lot of options.
Yeah, yeah. You gave it 9-mile radius, so that's a big radius.
Okay, let's see.
But that's okay. That's okay.
Oh, that's good.
Although it's being slow tonight.
Yeah, maybe I have too many things open. Wow.
Yeah, it should have given us results by now.
Should I revise to 5 miles?
Yeah, maybe go to 5 miles and see if that helps. I'm not sure why it's not loading.
Okay, let me try one more time. I will close some of my windows. I think maybe I have too many things open.
Okay.
Let's just keep this one more time. So we want to
Okay.
limit. Oh, so now.
No, you're back where you started. So go back to select a plan. Member guest home. You're going to have to go right back.
Okay.
Yeah.
Let's just do 5
Yeah.
miles or even 3.
Do 5 and see what happens here.
Okay. And we want to look up urgent care.
Sure.
Or maybe students, if you want to use your phone or if you want to search at the same time, maybe my internet is slow. To see if you come up with
we did a dry run earlier today and it worked just fine. So I apologize that this isn't showing you the page. But I'll just, please go to this page later today or tomorrow so you can see what it looks like. But what it does is it loads a whole list of, in this case, urgent cares, and it tells you the address, the phone number, and you can take your choice of which ones you go to.
Let me try one more time, just in case.
Okay. Okay.
So let's do, oh, something's happening. Okay, let's do 4 miles. See if 1 mile makes any difference. It's not happening. It could be my internet. Okay, one more time.
Well, Okay. And now you have to select the plan again, Aubrey,
Okay. This should
and then
come
go
up.
down. Yeah.
I try, it's the same problem. Okay. So it could be a network. I have one ambassador just text me saying that they are also encountering the same problem. So it could be a
Okay.
Aetna's network. We do apologize. We tried this morning, can't write up.
Yeah. But
So
yeah, please just, I apologize, and please go in there at some point. Oh, we are working to fix the problem. Well, wouldn't you know it? Okay, so Aetna's site is down, but once
yeah.
you get to the page, this is your last step before you see the page. It's very self-explanatory. It gives you the doctor's name. It gives you all kinds of information about them. So let's go back and we'll just keep going.
Okay.
Yeah.
Sorry about that.
So, yeah, so the information, what we just did is all here for you. It tells you, click on the primary PPO. It tells you everything you need to do to go back into that website. And the button on the front page that is the same link that we used right here on number one, step number one. So once you select your doctor, you need to, or your site, you need to please call them. And especially with COVID, you need to make sure it's okay for you to come in if it's the urgent care. And I would guess they'll say yes, and you go in, and then you make sure you have a picture or a copy of your ID card, and they may ask you for a picture ID card as well. So you may need your driver's license or your student ID. And they'll ask you to fill in some paperwork when you go. Anytime you see a medical professional, whether it's at student health services on campus, an urgent care, a doctor's office, a mental health office, your visit is strictly confidential. It's a visit between you and whomever you're seeing in that office. So when they ask you to fill out paperwork, that is just for their records. Your roommate, your parent, your teacher cannot call and ask, why were you in so-and-so's office at 4 o'clock on Friday? It's not their business. It's only yours. So please feel free to speak about whatever issues you're having because it's only between you and the medical professional that you're speaking to. If you were to end up in the hospital, say, for a few days and you wanted your roommate to converse with the doctors or your parent, you can grant that permission. But until you do, they cannot talk to anyone about what's going on with you. So what's covered on this plan? So treatment must be medically necessary. So again, if you're sick or have an accident, no problem with the coverage as long as it's covered on the plan. So no wellness visits, no acne visits, but pretty much anything else is covered. If you need surgery, it's covered in and out of network. If you go to the doctor and they say, we'd like you to have some blood tests, we'd like you to have an x-ray, we'd like you to have an MRI, as long as the doctor is ordering it, it's covered. But you cannot go into the doctor and say, I'd like some blood work done because I do this every year and I just want to make sure I'm fine. You will end up paying those bills. So I just want to make sure you understand the difference between the doctor ordering it and you ordering it. Same thing with physical therapy, chiropractic care. You may wake up one morning and your back is a little sore and you think, oh, I think I'll go to the chiropractor today. Well, you will get the bill for that. You would need to go to an urgent care doctor's office and for them to say, yes, I think this would be helpful for you. Let me write you a referral for this, and then it would be covered. Maternity and prenatal care is covered on the plan. prescription drugs are covered on the plan. Here's a little bit of information regarding your campus health center. Okay, so these urgent cares that are listed here are the 3 closest to campus. So if we had been able to get into the site, these 3 would have shown up. And we just put them in this document for you, so it's an easy search. But if you don't live near campus and you're sick when you're not near campus, then you would need to do that search and put your own zip code in. Okay. Physician's visits. I kind of just went through this, what you will need. You need to arrive early, show them your card. You'll need to fill out some information. Here are some examples of reasons you would go to the hospital emergency room. I went over a few of them: the car accident, you can't stop bleeding, you're having a heart attack, you broke your leg, you're coughing up blood, just really major, major reasons to go. That is why you would go to a hospital emergency room. But please try and stay out of hospital emergency rooms unless you have no choice. And you know, sometimes you don't have a choice. I always give this example. I don't have the same plan as you, but all of our plans try and keep us out of emergency rooms except for emergencies. I was on vacation, I wear contact lenses, and I was out for dinner on a Saturday night. I rubbed my eye, I guess. I don't know how it happened, but it had to have been my contact lens flipped over and got stuck way up in my eye. And I tried for about an hour to get it down. It's quite painful. It's like, you know, something's in your eye. And I decided, well, okay, I'll go to an urgent care. Well, all the urgent cares were closed for the night. Urgent cares aren't 24/7. They're closed sometimes by 6, sometimes by 8. And this for me was about 10 o'clock at night. So I thought, well, what's my choice here? I either wait this out or I go to the emergency room, knowing I'm going to be charged more money to go to emergency room, and knowing I'm probably going to wait a long time in an emergency room, because if someone comes in by ambulance, I may be there first, but they're more urgent than me, so they're going to be seen by the doctors before me. I chose to go to the emergency room because my eye was so sore. I'm glad I did, but I probably paid, I forget now, at least $300. It might have been $500. I did wait a bit, not a really long time, but I did wait a bit. So sometimes you have to make decisions for yourself. Should I do it or not? Knowing it's going to cost you money. So just be aware of that. Urgent cares aren't always open 24/7. So getting medication. Let's say you go to an urgent care and they say, we'd like you to get this medication. You take the prescription to any of the big pharmacies, Walmart, Walgreens, CVS, any of the big pharmacies will take your prescription. You hand the pharmacist your prescription and they will fill it right there. If you don't use an Express Scripts pharmacy, so Express Scripts is a company that works with the prescriptions. Smaller pharmacies, we call them mom and pop pharmacies. They're like the little one on the corner. There's a good chance that they aren't connected to Express Scripts. So if you go there, chances are you'll have to pay up front 100% and then get reimbursed by downloading a claim form here and sending it in. So it's really to your benefit to use the bigger pharmacies if you have a prescription to fill. You won't have to come out of pocket for money. It'll be taken care of right there. You will need to give them your insurance card because the pharmacy information is on the back of your health insurance card. After you visit an urgent care, a hospital, any type of doctor, if you present your insurance card, insurance gets billed for the visit. You aren't billed for the visit. If you don't have your insurance card, you will get billed for the visit. So again, always, always, always present your insurance card. The hospital, for instance, will send in a claim form to insurance. You will get something called an explanation of benefits in the mail. It looks like a bill. It is not a bill. It's just acknowledging that there's a claim on file for you from this particular doctor or from this particular facility. You need to take a look at this. Don't just throw it away or not open it. Please take a look at it, because you want to make sure that they got your visit date correct, that it is you, someone didn't steal your insurance card and is using your information. And then I want you to scroll down to the bottom of the page, and you will, I'm sorry, Aubrey, just on the letter you get in the mail, look down at the bottom of the page, and it will say patient owes. If this is your very first visit, you probably owe the $100 deductible. So it will say patient owes $100. If it is a visit and you've already paid your $100, but it says you owe $400.29, well, that should be a red light for you, because why do you owe money if you saw an Int'l doctor and you paid your deductible? So if you ever see something like that, please either call the phone number on that document and ask why you're being charged that amount. Or if you feel comfortable discussing your health issues, you can reach out to Aubrey. Aubrey can take a look at it, and more than likely she'll send it to me. And there's all kinds of mistakes that can happen. It doesn't happen all the time, but it happens once in a while, where either the doctor billed incorrectly or insurance billed incorrectly, or maybe you forgot and you went to get blood work done and there was no order from a doctor. So we have to figure out, why is this money being asked for you to pay? So please don't disregard it. Many times I just need to send it back in for reprocessing and it gets taken care of. That's usually what happens. Or the student forgot to show their health insurance card, so they're being billed for the full amount. But unless I know this is happening, I don't know to fix it for you. And you will get a bill from that facility or that doctor, and if you don't pay that, eventually they'll send you to collections. And they're not nice people. They go after you for the money, and it can affect your visa standing if it doesn't get taken care of. So please, always, if there's any question about an explanation of benefits or a bill you received, please bring it up with one of us, and we can help you resolve the issue. Okay. Coverage is worldwide. As I mentioned, you could be anywhere in the U.S., you could be worldwide. Usually if you're outside of the U.S., it's considered out-of-network coverage, so you're covered but not to the full extent that you are in the U.S., because chances are there is not a doctor in Costa Rica that you can see, for instance. If you receive treatment in your home country on the plan, you do have coverage, but it's only to a maximum of $1,000 per policy year. So please keep that in mind. If you're out of the country, you will need to gather your medical bills, your receipts, and you'll have to fill in a claim form to get paid back. More than likely, they're going to bill you, and you will need to be reimbursed by us. But within the U.S., as long as you stay within Aetna, you will be covered by the insurance. You won't be paying any money unless it's that first $100 deductible. So here are the phone numbers again. Don't forget about the no-cost language service if you'd like to use it. I know this is a really quick overview. I would really, really suggest you go back in and read through this at least one time, sometime between now and you know, the middle of August. And again, I'm so sorry about that Aetna site being down. It would be good for you to go back in and just play around with it so you're comfortable finding a provider should you need to. You'll really be glad you did if you get sick. Aubrey, I think we could open it up to questions.
Thank you for this very, very comprehensive presentation, Diane. We will stop the recording for now, and we're going to open up for Q&A.
Okay.